Assalamu alaikum. My name is Dr. Fatima Jackson Best, and I'm a public health researcher who specializes in mental health, mental wellness, and self-care. And I'm here to give you all some tips and advice to support your friends, family members, and fellow community members who may be unable to fast due to a mental health challenge or a mental health issue that they're experiencing and live with. First off, it's really important to say that we should not shame or blame anyone who can't fast due to a mental health condition that they're experiencing. There's already enough shame and stigma around mental health and mental illness, and there's no need to use religion to further marginalize them. What does help is for us to build up our personal and collective understandings of mental health and mental illness so that we can support people who are unable to fast during Ramadan. Secondly, mental illness affects us all, whether we're Muslim or not. According to the Center for Addiction and Mental Health, 1 in 5 Canadians will experience a mental health condition or challenge at some point in their lifetime. And by the time Canadians reach 40 years old, 1 in 2 have or have had a mental illness. So there are a number of reasons that can affect a person and prevent them from participating in Ramadan. Although living with conditions like bipolar disorder, depression, schizophrenia, and anxiety disorders may not exclude you from participating in Ramadan, people taking prescribed medications for these conditions may not be able to fast because a disruption in their medication schedule could lead to negative health outcomes. Also, while mood swings and irritability are common across the board for people who are fasting, people living with bipolar disorder or anxiety disorders can experience these more severely, and this can have a negative impact on their long-term mental health. And people who are living with or who are recovering from eating disorders like anorexia and bulimia may be unable to fast because the act of not eating can lead them back into unhealthy practices around food. If you're unable to fast during Ramadan, here are some tips and advice that will help you throughout the month of Ramadan. First, don't blame or shame yourself. Each of us is unique and different, and Allah understands those of us who are unable to fast due to health reasons. Instead of putting guilt on yourself, use it as an opportunity to build up your relationship with God and letting yourself understand your unique position in this world. Secondly, find other ways to participate in Ramadan. The amazing thing about this month is that there are a number of ways that we can participate. We can host iftars, go to the mosque for tarawih prayer, read the Quran in English or Arabic, feed people who are homeless or who are experiencing income insecurity. There are many ways that we can participate that go beyond abstaining from food and drink. And thirdly, seek support from your trusted family and friends. No one should experience Ramadan alone. Take this opportunity to confide in those who love you and who you love, and seek comfort and guidance from them throughout this month and beyond. Now, if you want to support somebody who can't fast during Ramadan for mental health reasons, here are a couple of do's and don'ts to help you along. Don't give unsolicited advice. If someone that you love confides in you about their inability to fast during Ramadan, listen more than talk. Don't use this as an opportunity to bulldoze a conversation or ask a million questions. This can be a valuable learning moment. Do your best to be lovingly non-judgmental. They will feel it and appreciate it. Secondly, do get more informed about mental health and mental illness. If a friend or family member confides in you that they're experiencing mental health, take the opportunity to do some research about it. With all of the extra time we have being less preoccupied with food, we have a lot more time to look up topics that can actually expand our mind. It's also important for us to remember that each of us has mental health, and all of us are deserving of having good mental health and engaging in healthy self-care. And thirdly, don't make a false relationship between a person's mental health and their spirituality. The last thing anyone needs is unfair and untrue relationships being made between a person's ability to fast and their relationship with God or Islam. There are millions of Muslims all over the world who can't fast for one reason or another. It's not our place to judge any of them. Instead, think about ways that you can meaningfully include people who cannot fast during Ramadan, whether that's asking them to host your annual iftar or offering to pick them up on your way to the mosque for tarawih prayers. I hope you all have a blessed and healthy Ramadan, and don't forget to take care of yourself and one another throughout the month and far beyond it.